Hey everyone, thank you so much for tuning into the Shut Up or Talk Up Wellness Lifestyle brand where we focus on mental health, emotional health, and physical health. Today we are continuing our health talk conversation with professionals, health and wellness professionals across the state. And we have the honor of speaking to Dr. Abby Abisogun. So I just want to say thank you so much for joining us today. I know that you're with the Shoreline Endocrinology Center, is that correct?
I am owner and founder of Shoreline Endocrinology in Savannah. Yes.
Okay, awesome. And I just want to let everyone know that we found her platform on social media. So before we get into the conversation, can you let our team or our audience know where they can find your platform? Our listeners that's in Savannah, Georgia, wherever they are.
Of course, we are on Instagram and Facebook. Our handle is at Dr.Abby Endo. So that's @DrAbbyEndo. So that's how you can find us.
All right, so that's definitely, ladies and gentlemen, you definitely want to get over there. So we're going to get into the conversation. Can you explain to our audience what is the role of an endocrinologist?
That's a great question because sometimes I get what does that even mean? So endocrinology is a branch of medicine that focuses on the endocrine system of the body. The endocrine system is made up of a network of glands that produce and secrete hormones. Most people have heard about hormones. And these hormones regulate various bodily functions, including growth and development, metabolism, blood sugar, heart rate and blood pressure regulation. So a lot of different functions are under the control of hormones. And so my job is to help people who have either a disorder or imbalance in one or more than one of those hormones. So one of the most common is insulin. Insulin is a hormone. And so one of the conditions I diagnose, treat, manage is diabetes. Most people have heard about diabetes. That's a disorder of basically insulin having, for some reason, either it's deficient or it's not working properly, so that blood sugar regulation is not what it should be. And so that's one example of what an endocrinologist does, is manage diabetes. But there are various conditions that we manage.
You mentioned the control. So is there a good control level or a bad control level when it comes to that?
It's not always, often it's not black and white. There's a lot of gray, but there are a lot of different factors that come into play, whether it's age or whether you're a man or woman, your genetics, your sometimes other conditions that you have that are not necessarily related to hormone balance. There are a lot of different things factor in when we're talking about hormones, but age, stage in life, male versus female sex, a lot of different things.
And so when I was growing up, my mom she's the mom that wants to make sure we utilize our health insurance. We go to the doctor. She always was like, go to the doctor, make sure you get your health checkups. You better not be having sex, but if you are, go. She was one of those moms, right?
Right.
But we never heard about an endocrinologist. We really only heard about primary care doctor, right? That was just that, your primary care doctor, possibly a dermatologist or GYN. And that's along the line. And it's later on in life we find out the importance of the endocrinologist or the endocrine system. And why do you think that is? Why do you think that people find out about endocrinologists later on in life when there is a problem? And why are we not sharing how important endocrinology is, like, early?
Yeah. Yeah, part of that is a great question. Part of that is related to exposure, depending on what region of the country you grow up in, and or as an adult where you live. You may not have a lot of endocrinologists in the area, so access is part of it. If your parents or you yourself, if you're in an area where there aren't that many endocrinologists, then what tends to happen is the primary care doctor or maybe the pediatrician may be in a situation where they are usually managing these conditions that maybe the endocrinologist would manage if there was one available, or if there were more physicians in that specialty available for them to refer people to. So that's part of it. But just like, knowing that that's an option, having the exposure is important. The other reason might be related to the fact that a lot of the conditions that we treat come on as people get older, and some of them are chronic conditions, but not saying that you can't have endocrine disorders. You can, as a kid, you can have endocrine disorders, as early as right after birth or even in utero. But a lot of times we're talking about adults when we're thinking, conditions like diabetes, thyroid disease, osteoporosis, high blood pressure, high cholesterol, which are the conditions that endocrinologists specialize in treating. So a lot of times those conditions do surface in your adult life and not as much in your adolescent or childhood. So you typically end up being maybe sent to an endocrinologist later,
certain
later on. Yeah. And go ahead, sorry.
You're the doctor. Go ahead.
But yeah, I mean, so some of it is just when the conditions most commonly will present. Often it's in adulthood.
Okay. So you mentioned a list of different types of conditions. Is that under? Can you explain the term comorbidities? Would that be considered comorbidity, like a list of different types?
That's a good question. So comorbidities are just different, health conditions that exist together. And sometimes, people will have a list of health conditions that exist together, which may or may not be related to each other. For a condition like diabetes, for instance, a lot of times it comes along with conditions like high blood pressure, high cholesterol, obesity. We call that the metabolic syndrome, where you have all these conditions that kind of present around the same time, or one after the next, in the same person. So anytime a person has one condition, if they have other conditions they also are being treated for, need to be treated for, then we say those are, comorbidities, because, each has its own effect on their quality of life, their longevity, and so sometimes all of those things added together may significantly impact that person's quality of life, or reduce how long they're going to live if they're not treated appropriately.
Okay. In regards to male or female, when it comes to hormones, do women have more hormones than men? Do men have less hormones than women, or there isn't anything that differentiates that?
No, it's just mainly one of the main differences between a man and a woman hormonally is the ratio of certain hormones that we call sex hormones, meaning that these hormones in their actions contribute to differentiation physically, and as far as how you perceive a man versus a woman, their facial hair pattern, voice quality, you know, growth of breast tissue, you know, all these things are under control of hormones.
Okay.
But for instance, a woman has testosterone in her body. It's not like there's no testosterone, though we associate testosterone with being, you know, male.
Right.
But women have testosterone production in their bodies as well. It's just not as much as estrogen. So the balance between estrogen and testosterone depends on whether the person is a man or a woman. And so, you know, it's more complicated than, you know, just like I said, but there are a lot of hormones, and some of them are specific to sex, but you'll still find that the other sex has that hormone just in a different level, like a different level is considered normal versus abnormal. So we take that into account when we're interpreting testing, you know, hormonal testing. A level that I will check for a woman, what's normal, will be totally different for a man when I'm looking at a hormone like testosterone, for instance.
Right. Okay. And so I wanted to dabble into thyroids. So hormones affect thyroid as well. That's
well, the thyroid gland is a gland that makes hormone and responds to stimulation from a hormone called thyroid stimulating hormone. Yeah. So the thyroid sits at the base of the neck. It's butterfly shaped. It makes thyroid hormone, which is a hormone that's important in how we basically generate heat or metabolism. And so it has various functions, but you know, one of the main ones is regulating our metabolism. And it is made under stimulation from the pituitary gland, which is another gland. It's the hormone control center for the body. So the pituitary controls how the other glands throughout the body make hormone or don't make hormone, you know. And that gland is located right underneath your brain. It actually, you can get to it by going straight up the nose towards the back, in the middle of the skull, basically. And that gland puts out various hormones into the bloodstream that then go to the destination gland, like the thyroid, and sends a message for certain things to happen, like hormone production or reducing hormone production, things like that. So.
Okay, so yeah, that's interesting. When it comes to, what about infertility? That also your hormones affect that.
Play a role, yes.
I'm not sure because I'm just asking.
Absolutely.
Okay.
Yeah, that's one of the conditions that a woman or man may see an endocrinologist for, is if they've been trying to conceive and they're having difficulty, it's been a couple years and there's been no success, then yes, you need a hormonal evaluation, because certain hormonal abnormalities like thyroid dysfunction can make it more difficult to conceive. That's just one. There are various issues that can be hormonal based that can lead to infertility. And so that's one of the things that I do is diagnose and treat, you know, reproductive and, you know, issues and some infertility. Some of it has to go to a fertility specialist, but I do that as part of my practice too.
As part of your practice, Shoreline Endocrinology, do you guys do online visit? Like, how, if I wanted to be a patient, if any one of our you know, supporters, you know, we do life coaching. I'm one of the life coaches, and we have other life coaches and one therapist on board. But sometimes we have conversations, you know, and if something is out of my scope, I am a big believer that this isn't my profession. I have a more of a network, you know, tech background, but I'm more so like, if I am not equipped to assist and give information on a specific topic, I want to be able to refer you There's, because
Right.
Google and social media is not the answer. And I always tell people, and even my life coaching clients, you can go to Google, you can even come on our page and they learn a lot, but it's your responsibility to reach out to a provider, make contact with a provider, because you may have a specific situation that Google and Instagram and TikTok may not be able to pinpoint.
Right.
So I encourage everyone that even those who are listening to the health talk, this is just information we're sharing, but it's your responsibility to make that appointment. And with that being
Yes.
said, how do someone set up an appointment with your team?
So we are, yes, to your first question, we do virtual visits. So,
Okay.
sometimes, because of the pandemic, we've changed how we do things quite a bit in some ways, but we do both virtual visits and in-office visits. If someone wants to set up a new consultation, it's very easy to do. There are various ways you can get in touch with me. You can call our main office line, which is 912-483-9313. Or you can go to my website. It is www.Dr.AbbyEndo.com. So on the website, you can, of course, learn about the practice. You can, see how to get to us, our location and all that. We're in Savannah, Georgia on Waters Avenue. You can also request an appointment. So there is a page where you can go in, enter your information and send it to us, and we will give you a call and get you all set up, whether it's a virtual or an office visit. We can do either. So that's another way to make contact. You can also find us on, like I said, Instagram or Facebook, Shoreline Endocrinology, or put in the @Dr.AbbyEndo handle, and you can actually request an appointment from our Facebook page as well. So there are quite a few ways to get in touch.
Yeah, and so do they need for each
No referrals needed.
No referrals needed, and so call the office. Pick up your phone, call. If there's any questions, go on the website,
Yep.
call and ask any question to inquire, insurance information, whatever. If you want to pay out of pocket, however, call them directly to get that information.
I will say, just to put it out there, just so you know, my style of practice is actually direct payment. What that means is that I am not taking or billing any health insurance companies. We put all of the pricing on the website, so you know exactly what a consultation costs. There are no bills after that. What you pay for your consultation is a one-time fee, and that's it.
Right.
We, have our fee for a follow-up. We have our fee for lab testing. In the office, all those things are listed on there. Thyroid ultrasound, thyroid biopsy. So one of the goals in starting this practice was to give people the choice. You choose where you're going. Your insurance is not the one dictating which specialist you can see or not see because they're in network or not, in network. You choose, you come, I help you, the best way I can. And so it's all upfront. There's no 3 months from now you get some big bill and you're like, wait a minute, this is not what I was expecting.
Right. And especially dealing with, when you have complications or you're in a state of worry or uncertainty, finance is such a big thing. We also spoke to a financial wellness coach as well.
Yeah.
Because that's a part of wellness, and we spoke to her, and she let us know it starts with money management, and if you're putting money aside for health, and it's a lot, but we're trying to get into it for the audience.
That's
and,
excellent.
Yeah, it's so important. We're gonna wrap up, but before we go, we kind of want to ask you some questions about diet and fitness, or any tips or insight. And remember, everyone, I'm an advocate of you going to find your own provider. So, you can listen, but, we don't want you to say what doctor said. We want you to take this information to trigger something in you so you can go and further educate yourself as well.
Right.
But are you able to share anything about fitness, food, nutrition, anything quickly before we wrap up?
Yeah, I'll share one quick tip, because I think when people think exercise, they assume they have to do something extraordinary for it to count. But just 30 minutes a day of walking, just walking, brisk walking, not running a marathon, not sprinting, just 30 minutes walking can help you prevent diabetes, obesity, some of these health conditions that affect people and are chronic, so therefore affect their quality of life for years. So you don't have to be in the gym for hours at a time. You don't have to be training like an Olympian in order to, improve your health.
Right. And what about water? And
you cannot go wrong
can't
with
go
water.
wrong with it. So walk in water.
Absolutely. There are a few exceptions, people who have certain conditions like heart failure and stuff. This is where, like you said, you want to discuss with your doctor directly, because everything doesn't apply for everybody, right?
Yes.
But yes, in general, water is good. More water. Most of us can stand to drink some more water.
Yes. Well, thank you so much, Dr. Abby.
Absolutely.
Abisogun. Yes.
Dr.AbbyAbisogun.
Abisogun. Oh, Dr.
It's
Abby.
a mouthful.
Listen, and we're actually so happy to have you take the time out to have this conversation. Ladies and gentlemen, this is the Shut Up and Talk About. Thank you, Wellness Lifestyle Brand. We are continuing our health talk with a series of individuals, of professionals that contribute to health and wellness. And we just want to say thank you again. And don't forget to go to the website, check out the website, book your appointment. Everything is on the website. We're going to have the information below. And thank you so much again.
Thank you.